I think one of the things about Emory is that we've been blessed to have some very large donations by a very small number of donors. And one of the things that we struggled with is trying to expand the net, trying to reach out to those in our community, those in the region, and tell them who we are, tell our story, and to be able to get them to come and to at least understand when they do give where it's going and where our needs are for possible future giving. So having a program like Doc for the Day allows us to bring those parties into our institution. Unfortunately, many people think that because we have the endowment that it's an unrestricted endowment. They don't realize the restrictions. They don't realize that we're not going to touch the corpus, that we need to go ahead and have new money coming into the organization in order for us to continue to grow and to develop new programs. And this allows us now to educate them. It's just sort of, we're planting the seeds, now we need to sow it, we need to have fertile ground, we've got the seeds in there, now we need to let them germinate, and then hopefully we'll be able to reap what we're sowing, so to speak. I think Dr. for Day, I mean, it's a unique opportunity for us to bring in partners, to let them see what their money's going for, or what the potential is for our organization. Possibly some of them are patients, maybe some of them will become patients, but we're more than that. We're here for the community, we're here for the region, we're here for the nation. We're here as an international destination, and in order to continue that, we need to continue to partner with our donors.
There was some level of resistance, or I remember being told, that's impossible, we can't do that. Do you remember, do you have any thoughts about that? Do you remember any of those comments, and where do you think those were coming from?
Well, I definitely remember them. I was one of the more vocal parties with respect to that. I think the big concern was HIPAA. You know, it was privacy, and we truly are. We are a patient family-centered organization. And I think that most of us felt that this could be a violation of who we are and our relationship with our patients. So one, we really need to feel comfortable and be reassured that that would not be violated. And we're not even talking about the federal laws. We're just talking about our culture, our relationship. And I think we're able to do that and at the same time fulfill all of our responsibilities with respect to state and federal laws and patient confidentiality. We require, you know, our visitors, our Doc for the Day, to sign some of the same HIPAA forms that our doctors do, our nurses do. We make them go through essentially part of our infection control module, making sure that the immunizations are up to date. These are the things that concern many of us, and fortunately we've been able to surmount those. We've been able to do what's right and yet maintain that relationship with our patients. And the patients have welcomed it, and that was another concern. How would the patient feel if they knew we were bringing in these strangers, you know, these businessmen, these suits, coming in to watch their surgery, watch their procedure, or even speak to them? But everybody's really been open. Yeah, we're an academic institution. We're here to teach. We don't care who the audience is. We'll teach to anybody. And I think it gives the faculty, gives the nursing staff an opportunity to showboat. And we do a lot of things here. We're excited. We're proud of what we do. But you know, a lot of times, if you don't read our papers, if you're not one of our patients, you're really not aware of it. So it gives us a chance to really communicate with others in the community, and many of them are community leaders who really don't know what goes on within our four walls. It's becoming more visible. You know, one of my concerns for years is that, you know, every institution that I've graduated from I hate to use the term, has hit me up frequently, multiple times. And you know, it's the beginning of their campaign, and then it's going to be in November and December trying to close. And I think we lag behind here at Emory. And again, as I said earlier, we went for those big foundations, the ones that we could always depend on. And as a result of that, we left a lot on the table. We're now doing that, and more important, we're now developing a sense of giving within our community. So it's easier now when you're bringing in philanthropists that our employees, our physicians, are more in tune with giving to the institution. It's a lot easier to go ahead and then incorporate outsiders into our Doc for the Day program and have active participation with our employees. With respect to my own role, and again, I have multiple roles. I'm a chair of a department. I'm also chief medical officer of the hospital. You know, I'm here to go ahead and to showboat, to show the institution, and to encourage people to assist us in programmatic development. We're not going to be able to achieve the things that we've done in the past depending on clinical revenue. It's not going to be clinical revenue, and it's not going to be research grants. We're going to have to depend more and more on philanthropy. All of us need to play a part in that. And in my roles, I need to play a major role with respect to bringing in philanthropy, introducing them to our organization, what we're doing, and more important, what we want to do in the future, because it's going to be pivotal to have their support. Well, I can tell you, as a result of the changes that we've had here at Emory University and Emory Healthcare, I hardly gave, and now I'm giving multiple times throughout the year and encouraging colleagues and employees to do that. So from that perspective, you know, I think it's had a big change. I think it's the realization of what makes this institution successful, and it's all of us. And when I say all of us, it's the patients, obviously, because they and their family are the center. It's our nursing staff, our ancillary staff, our physician staff, our administrative staff, and our donors. They are part of our family. And I think in the past we kept them separate. So we had our family and the stepchildren or the step cousin. We're actually the same. We're all part of the same family. We all need each other to achieve our goals. I'm not going to be happy until we have 100% giving by our employees. And I think one of the problems we have is trying to convince our employees it's not giving the $1,000 or the $100, but it could be the $5 or the $10. And I think when we've achieved that, then nothing will stop us, because everybody will be looking at us and looking at our commitment to our organization. It'll be a lot easier asking for others to support us when we can say we're supporting ourselves.